Welcome back to the most news in the morning. President Obama is pushing ahead with his health care plan, talking with business leaders later on today. He's also looking to the healthcare industry to help shed $2 trillion in costs over the next 10 years. And the president says the time to act is now.
We can't continue down the same dangerous road we've been traveling for so many years. The costs are out of control, and that reform is not a luxury that can be postponed, but a necessity that cannot wait.
Joining me now to talk more about the plan is Health and Human Services Secretary Kathleen Sebelius. She's in Washington. Governor, it's great to see you this morning. Let me ask you, though, everything seems great on the surface here with the healthcare industry saying that they're going to do their best to save a whole bunch of money, but the promises are vague. None of the savings are guaranteed. None of the proposals are enforceable. So what do you really have here?
Well, first, you had a breakthrough moment yesterday, John, with the industry leaders in the room committing to work not only to immediately start to lower costs, but to work with the president on health reform. Dial back to the early 90s, and representatives of those same groups were already on the airwaves battling the notion that we'd have health reform in America. So coming together in a voluntary fashion, agreeing that they need to be part of the solution this time, they need to work with the president to frankly, make sure that all Americans have high-quality, lower-cost care, because we can't sustain what we have right now. It's unacceptable and unaffordable.
Yeah, I mean, certainly there are huge problems with health care in this country, everything from cost to coverage.
Yes.
But, you know, when you look at and you contrast between what was happening in 1993 when the Clinton administration was trying to write new health care legislation in secret behind closed doors, and now where you've got the health care industry coming inside the White House there with a seat at the table, do you think that that will yield more results than back in the 1990s?
Well, President Obama has said from the outset he wants this to be a process that's very engaged. He started with a health summit with Republicans and Democrats from Congress, with industry leaders and providers, with union leaders and other stakeholders at the table. I think this is another step forward, bringing the leaders of the health industry to the table, but also they voluntarily making a commitment to work immediately to start reduced costs. Americans who have health coverage that they like and want will be able to keep it, but no one can keep affording to pay more and more every year for the kind of health care costs that we are seeing in America. So this is a big moment. Today, the president meets with business leaders who have been providing health coverage to their employees because they know having a healthier workforce makes a healthier America, but also they want to put more emphasis behind prevention and wellness. These are innovative strategies that are underway right now in America, and those ideas should inform Congress as we begin to see the health reform legislation be written.
So again, on the surface, all of this looks really good. But there are some people who are skeptical of this. Paul Krugman, Nobel Prize-winning economist, is one who thinks, is the healthcare industry a bit like a Trojan horse? They're now inside the walls of the White House. They do not like your plans for universal health care. As you mentioned, Congress is going to start to write that bill in the coming weeks or month. Could this just be the healthcare industry looking to leverage its cozy relationship with the White House to oppose that healthcare legislation that's going to be coming down the pike?
Well, I'm hoping that they are sincere about what they say inside the room and outside the room. And what they committed to yesterday was a voluntary pledge to not only reduce costs starting right away, but also to work with the president. I think it's a very different dynamic. I think that healthcare leaders understand that the current path of paying more every year, getting worse health results, doesn't work, that the American people are demanding change. It started with the election of this president, and he made it very clear that this is his #1 priority. He intends to push forward on health reform, and I think they've figured out that they'd rather be at the table than be outside the fence. So we need their tools, their expertise to drive a new system.
And looking down the road, that the cost of health care reform estimated between $1.2, $1.5 trillion. The president has funded about half of that. Where's the rest of the money going to come from? And will this, as some critics have suggested, be a recipe, particularly in these troubled economic times where we're running deficits of $1.8 trillion? Will it be a recipe to bankrupt the nation?
Well, I think just the opposite is the case, as does the president. You can't fix the economy without fixing health care. individual families, business owners, government agencies understand that the current health trajectory, the costs rising dramatically every year ahead of any other prices, can't be sustained. So we want to make sure that all Americans who have coverage they like keep the coverage. Choice is an essential component, but we're paying too much and getting too little for the millions of Americans who are either underinsured or totally uninsured, who come through the doors of emergency rooms and get the least effective, most expensive care.
Well,
that fix in and of itself will save dollars and save lives.
No, we'll see. I mean, we'll be watching all of these proposals very closely, but as you said before, no question, something's got to be done. Kathleen Sebelius, the new Secretary of Health and Human Services. Good to see you this morning. Appreciate you coming in.
Nice to see you, John. Thanks for having me.
Karen?